Hello everyone, and welcome to our educational discussion on Kyleena, a type of intrauterine device, or IUD. This session is intended to provide information for educational purposes only. For any specific health inquiries or decisions, please consult a healthcare provider directly. Description: Kyleena, scientifically known as levonorgestrel-releasing intrauterine system, is a small, T-shaped device that is inserted into the uterus to prevent pregnancy. It slowly releases the hormone levonorgestrel, which is a form of progestin. This hormone works by thickening cervical mucus to prevent sperm from reaching an egg, thinning the uterine lining to prevent attachment of a fertilized egg, and partially suppressing ovulation. Approved by the FDA in 2016, Kyleena is effective for up to 5 years and is one of the most effective forms of reversible birth control available today. It is particularly suited for women seeking a long-term, low-maintenance contraceptive method. Warnings: Kyleena is not suitable for everyone. It should not be used by women who have abnormal uterine bleeding, a history of pelvic inflammatory disease, unless they have had a normal pregnancy after the condition was treated and resolved, known or suspected breast cancer or other progestin-sensitive cancer, liver disease, or uterine abnormalities that interfere with the insertion, fit, or retention of the IUD. Women with active pelvic infections or untreated cervicitis should also avoid using Kyleena. Before taking this medicine. Before deciding to use Kyleena, it is crucial to discuss your full medical history with your healthcare provider. Inform your doctor if you have had any of the conditions listed in the warnings section, as well as any recent infections, pregnancies, or if you are currently breastfeeding. Kyleena can be inserted immediately after childbirth or abortion, but your doctor may recommend waiting until you fully heal. Be sure to discuss all potential risks and benefits of using this IUD. Side effects: while Kyleena is generally well tolerated, it can cause side effects. Common issues include menstrual changes such as increased bleeding, spotting, or amenorrhea, abdominal or pelvic pain, ovarian cysts, and discomfort during insertion. Less common but more serious side effects include device expulsion, perforation of the uterine wall, and severe infection. Signs of serious problems include severe abdominal pain, heavy or prolonged vaginal bleeding, unusual vaginal discharge, fever, and chills. If you experience any of these symptoms, contact your healthcare provider immediately. Interactions: since Kyleena works locally within the uterus, systemic interactions with other medications are unlikely. However, it's important to inform your healthcare provider about all medications you are taking, including over-the-counter drugs and herbal supplements, to ensure there are no contraindications. Dosage: Kyleena is a one-time placement that provides up to 5 years of birth control. The insertion process is performed by a healthcare professional in a clinical setting. No daily, weekly, or monthly maintenance is required, although it is recommended to check the IUD's placement periodically by feeling for the removal threads. If at any time the threads cannot be felt or if you feel the device itself, contact your healthcare provider. Avoid: post-insertion, it's advisable to avoid tampons and menstrual cups for the first few days to reduce the risk of infection. Also, avoid strenuous activities immediately after insertion to prevent discomfort or displacement of the device. FAQ: many people ask about the reversibility of Kyleena. It can be removed by a healthcare provider at any time, which quickly reverses its contraceptive effects, allowing for a return to fertility. Another common question is about the timing of insertion, which can generally occur at any time during the menstrual cycle, as long as it is confirmed that you are not pregnant. Closing: this concludes our overview of Kyleena. We hope this information has been helpful for understanding how it works, its uses, and important safety considerations. As always, for personal advice and specific medical questions, please consult your healthcare provider. Thank you for joining us today.